Me? Good afternoon, everyone. My name is Jennifer Ma, and I'm the Dean for the Faculty of Health Studies at NorQuest College in Edmonton. I've entitled my presentation, Creating Connections. My trade would go, I am a nurse, so that seems very stereotypical, being a Filipino woman. However, I do think that most of the nurses are on the front line, and very few get to positions of leadership and have the ability to influence the landscape and trajectory of nursing within my community, but also worldwide. And so I do feel fortunate to be able to do that and work in many countries around the world. So next slide, please. Here is just a little bit of a picture of where I'm from. So I'm from the Western Province in Alberta in Canada, and I work in a college that I think is quite progressive in that we focus on helping BIPOC people, so Black, Indigenous, and people of color. And we serve 137 people from 137 countries worldwide. So I feel fortunate to be able to learn about many cultures throughout the world and help people to realize their dreams. Next slide, please. Oh, my eyes are bad. I'm gonna have to turn this way. So we heard earlier about shortages of nurses worldwide. They're predicting that there will be a shortage of 13 million nurses in the next 10 years. And this came from the International Council of Nurses only last year. They are predicting in Canada a shortage of 60,000 nurses worldwide. That was last year again. With the pandemic, and worldwide shortages, more non-practicing nurses, an aging workforce, and retirement and burnout and mental health, the number is actually probably bigger. And so by mock-ups of what the shortages look like would actually have been 117,000 in Canada, but that was prior to the pandemic. So I can't even suggest what it would be after the pandemic. Next slide, please. So why is a shortage important? Because health is important. And as anyone knows who doesn't have their health or who is suffering from any kind of ailment whatsoever, you realize then that without health, you have not very much. We don't have, money doesn't make any difference. Going for a walk can be hard. So health is really important. And most of the nurses, like we've heard before, are Filipina nurses in almost probably every country. Not every country. I was just in China, and those nurses are definitely not usually Filipina nurses. Next slide, please. A few other facts that I think that are important. My previous pitch was going to be creating a new system for nursing and a new education system where there would be an apprenticeship model. So typically being a female-regulated profession, people didn't usually get paid when they are going through their nursing education. Whereas if you compare it to things like carpentry, electrician, which are mostly male-dominated, they get paid for the practicums that they do. And so I was hoping to be able to create something where women would be paid, and particularly Filipino women. And international nurses coming to Canada would get paid for the education that they did. Fortunately, or unfortunately for me, the landscape has changed rapidly in the last few weeks and months, and Filipino nurses and nurses around the world can come and practice in Alberta without going through a lot of red tape, if you will, and can go straight into practice. So that is good for people. Sorry, just one back. So there's lots of changes. 40% of internationally educated nurses are from the Philippines, with 37% from India. The domestic nursing programs have increased their numbers, but have not kept up to the demands in the field. There are things like tuition bursaries, where education is paid for now, and then there's large gaps in rural areas, particularly for Canada. And healthcare is plagued with fatigue, burnout, and actually maybe even a hostile environment for workers right now. Next slide, please. So my pitch is really, I think, something very simple in that it's creating connections and helping people that are coming from around the world to work as nurses in Canada, particularly in my province, with supports, and to be able to function and understand the nursing system so that it doesn't impact their mental health, their self-esteem, and their confidence. And one of the things that that sticks in my mind is that things are different. And if you don't see differences, you don't see me. Because I think that every one of us is different. And we have to see what those differences are and what the gaps are to be able to bridge those gaps and to support people. And support them with their confidence, their self-esteem, their self-worth, their mental and emotional health, and creating connections so there's not social isolation. So it is empowering people with knowledge, using technology to bridge those gaps, and listening. I think that the piece I think that I do well, is to listen and to find those gaps and to create systems to be able to bridge those gaps. So prior to people coming to Canada, I'm hoping to help them with their settlement, understanding what the weather and the culture is like in Canada, arming them with supplies, and then helping them understand the health culture, using virtual reality and other technologies to help to create that understanding, and then mentoring and connection forums. So similar to what we heard maybe earlier. And then once they arrive, really to have mentorship and connections with people within the Filipina community and people who have gone through that so that they can hear from others and learn from their journeys. Thank you. How can you help? Well, what I would like to see is, what I would like to hear from you. What was it like to work in another industry, in another country, to ensure that the systems that I'm creating are actually meeting those gaps. So I'd like to hear from people within my area, but also from you. You are leaders in your field, and you've heard and talked to so many people, and would love to collect the knowledge and your power, and be able to harness that power and create systems to help other people transitioning. And then the other one is really connections. Connections with people in various fields, and to be able to hear from them. Thank you very much.